It's incredibly common to actually have mental health problems after you have any kind of heart procedure, heart surgery, heart valve surgery, a stroke. And we can see a whole host of things. We can see anxiety, depression, post-traumatic stress disorder, even for patients, for example, that may have had a cardiac arrest or may have had a crippling stroke. They can actually have flashbacks or relive the events. And interestingly enough, we can actually see mental health disorders occurring in their caregivers as well, or anyone who may have witnessed the event, so to speak. And it's pretty common. It can be, a third or more, sometimes 40, 50% of patients after some kind of cardiovascular event or procedure that can struggle with these conditions. It really relates to the degree of kind of physical and mental stress, as well as the circumstances of the condition. So some of it obviously, is treatment related. So we know that beta blockers, which can slow down your heart rate, slow down your blood pressure, can actually be associated with fatigue. And in some people who have a predisposition can uncover signs and symptoms of depression. And after a cardiac condition, we often put patients on beta blockers. Some of it is actually related to the recovery period. So if you've had a bypass surgery or valve surgery that's completely knocked you off your feet and changed kind of, the function of your life, the quality of your life, that can certainly exacerbate a lot of mental health conditions or cause mental health problems, and people can struggle with that. I alluded to the fact that sometimes it can be the experience itself that can be jarring, that could have created the circumstances. And then sometimes actually it's the cardiovascular perfusion to the brain. And so if you think about it, most kind of common way to think about it is a stroke that can affect some parts of your brain that are involved in emotional regulation. You can get emotional dysregulation after you have a stroke or a blockage in the blood vessels that supply that part of the brain. So it's really complex as to why, people have different types of struggles after some kind of a cardiovascular event, but it's multifactorial. It's related to a number of different types of things related to that event. I mean, there are huge dangers. This can impact their prognosis. It can impact their recovery. And, if somebody's profoundly depressed, they can be non-compliant with medications. They can, have effects on their nutrition, for example, which can obviously affect wound healing, which can affect cardiovascular recovery after heart attack. Their ability to participate in, conditions like cardiac rehab, programs that help them get stronger, help them have better prognosis, those can be limited. Sleep is a big piece of this. If you're struggling with, anxiety or depression after a cardiovascular event, obviously that can create problems with sleep, which can trigger inflammation, which can trigger changes in your blood pressure. If you're struggling with anxiety after you've had a cardiovascular event, that can cause a sympathetic surge that can change your stress hormones and your catecholamines, which can affect the function of the heart itself. So we see it's really, a conglomeration of obviously behavioral things that can change your prognosis, physiologic conditions that can change your prognosis, as well as, a lot of other things like hypertension, sleep, nutrition, ancillary health conditions that can contribute to a worsening prognosis. So we know that people who have depression or anxiety after cardiovascular events, they're high risk. They have a flag on their head. And we as providers really need to step it up and work to try to recognize those patients so that we can do something about it. I think awareness amongst healthcare providers is the biggest piece of it. Often we think about treating their heart, not their head, because we're so focused on their medications and their blood pressure and their heart rate that sometimes we miss those subtle clues that tell us that they're depressed or that they're anxious or they have PTSD or that they're struggling with some sort of mental health problem. So I think having our radar up when we are evaluating these patients after any kind of cardiovascular event and evaluating the family members and caregivers, that's really important. So I would say awareness is the biggest piece and recognition is the next sequela of that. Once you've recognized the problem, I think you need to figure out what the core cause of it is. You need to figure out how long it's been going on, and then you need to figure out how to design a treatment plan to address it, because the treatment is the really important last link. I would say sometimes that's the weakest link because we recognize patients are depressed and we sort of chalk it up to their beta blocker, to the fact that they just had a big stroke, or, that fact that they knocked off their feet with their heart surgery or whatever. And we don't sometimes take it to that next level of saying this is clinical depression that we need to address. And figuring out, I would say, a multidisciplinary plan for addressing that depression. So it doesn't necessarily just mean an SSRI, but really a combination of possible medications, thinking about cognitive behavioral therapy, especially for patients with stroke who are going to have long-term risks of having depression because they're struggling with those functional impairments, and then also helping them to create a community. And that's where I really like the cardiac rehab, because it automatically creates that community for our patients. So encouraging them to comply with it, because when they go to rehab and they meet somebody else who just had a stroke, or somebody else who had a stroke a while ago and now is doing better, it can really help them come up with coping strategies that can help their family members and caregivers as well. So I would say awareness, identification, and then a multimodality approach to treatment are the most important things that we can do as healthcare providers.